Morning, it's Dr. Eric, the fitness physician, where I talk about all things related to hormonal fitness, muscle medicine, and much more. So I started a little mini series on nitric oxide and how important it is. A lot of people have heard about it, but I'm going to delve into more of the nuances of it and dig a little bit deeper as to why it's so important. Right? Okay, so one of the reasons that it hits pretty much every system in the body. This is why it's important, just like hormones, to be optimal. Too much, too little is bad. So it affects multiple systems throughout the body. Cardiovascular, of course, is the most known about, right? Everything in terms of vasodilation of the arteries and the capillaries, vascular tone, meaning how the relaxation or the dilation of the blood vessels is what you want. You don't want to be too high or too low. You don't want to have high blood pressure, be hypertensive. You certainly don't want to be low, but most people, especially nowadays, are trending towards the high side, right? Because of too much stress or inadequate diets, or a lot of hypertension or high blood pressure is very prevalent, and of course can lead to vascular atherosclerotic disease, cardiovascular disease, and much, much more. It affects the permeability of the blood vessels, right, which can affect everything. Things can leak out of the blood that we don't want to leak, right? We want the appropriate permeability. We want the good stuff going in, the bad stuff going out, right? Leukocyte adherence, meaning the white blood cells. This is huge with heart disease because it has to do with macrophages and monocytes, the white blood cells, the immune cells of the body. And if there's inflammation, they can get attracted. And they get attracted to the blinding of the blood vessels and basically cause even further damage and inflammation. Going in and healing it acutely is normal. That's what they're supposed to do. But when there's excessive inflammation, they build up too much. You have too much of this, too much adherence. Then these can become inflamed. These macrophages become what's called foam cells, and that can cause even further damage and inflammation, which is what we don't want. So it's all about controlling this. In the nervous system, nitric oxide is integral for neuroprotection, for transmission of nerve impulses, of neurotransmitters, and of course, what we call nociception, meaning all your senses are activated. The nerves are transmitting messages the way they're supposed to. Massively important in the immune system, has our defenses to viruses and bacteria, the innate system, the adaptive immune system, and superoxide radicals, right? Again, if you have too much of this, or you have inflammation or other immune dysregulation, if you have nitric oxide, it can be too much of it can be turned into peroxynitrite or other excessive free radicals, and it can cause damage. This is why you have to control the inflammation and control your body's immune system and overall metabolic response with everything that we do, right? And we want the appropriate response to this. On the flip side, you want enough of the superoxide because it's going to kill the bad guys, right? It's going to kill the bacteria and the viruses, and we want them dead. Respiratory system, of course, again, dilation and permeability. We want adequate blood flow through the lungs so we can breathe and exercise, right? This was huge with the immune cytokine storm that we saw with the viruses and COVID of last year. We want appropriate control of the respiratory system. Urogenital, meaning your urinary system. The urinary system has to do, of course, with this is huge with sexual function, right? Of course, we think about this with men and with women, sexual function and dilation down there, so you have the appropriate responses. And also has to do with the kidneys too, right? What we call GFR endothelial. You want the kidneys adequately perfused with oxygen and nutrients. If this gets dysregulated, this is a huge cause of not only electrolyte problems, but high blood pressure and cardiovascular disease, and of course kidney disease, which can lead to all kinds of metabolic problems. I saw tons of this when I was on the wards in the hospital. So kidney function, urogenital function, massively important. Of course, endocrine system, I wrote all because it affects everything, right? This is where we get into hormone optimization with men and women, whether it's testosterone, estrogen, thyroid. It affects pretty much everything. So again, you want adequate blood flow, you want adequate inflammation. This is why nitric oxide is so important to get it just right. You don't want to be taking these generic, crappy nitric oxide boosters to get your gains going, bro. You can buy this crap over the counter because it's loaded with bullshit that you don't want. You want to do it right, in the right way. Typically, you can do this with nutrition. However, if your gut, your microbiome is off, you may need some supplementation. There's only a couple companies out there that have a quality product that I recommend. So if you're interested, DM me and I can reach out. I can get connected with you and help you. These are typically only through clinics because they're just higher quality and they're great. I've tried them, I use them myself. But again, if you don't want to do that, you can do other things as well. But again, you want to be smart about this. That's what I see all the time on social media. People promoting all kinds of bullshit products that just don't work. And again, I get nothing out of this. I don't get any commissions or anything like that. But I just want what's best for my patients and my clients. I want you to feel your best and look your best. I don't want to have you a full optimum system so you are the superhero that you know you can be. I love my superheroes. I'm always promoting. I want my patients and clients to have a superhero physique and health so they can live to give and give back to those around them. So anyway, please like and share this post, share it around, and stay tuned. I'm going to be doing some more specific videos on some of the specifics of nitric oxide. So stay tuned. Again, like and share this post, comment below, and everyone have an awesome week. We'll talk to you soon. Bye.